I'm going to talk about the health impacts of air pollution in Ireland. Um, so, open disclosure at the start, I did research into air pollution, but before I started researching air pollution, I used to love a solid fuel fire. I moved into this house here and used to come home and light fire every night really during winter, and used to think that I was being okay because I was burning dried wood and eco stove and thought that that was great. But really, my research has shown the background research I did as well when conducting research showed that that was a lie, really. So air pollution affects so many different parts of our body, and in fact, and impacts so many different parts of our health. It causes things like asthma, COPD, affects our lungs, but it also affects our heart. It can cause heart failure, heart attacks, strokes. Can also cause dementia in the long term, and can cause Parkinson's disease, can cause rheumatoid arthritis, chronic kidney disease. The list goes on. And it's even been linked with COVID-19, where in countries with high levels of air pollution in Europe, there's an 8% increase in COVID-19 mortality. So it's been linked with many, many different diseases in various different studies across the world. Not to get too technical into what the mechanism is, but there's two particular ways in which air pollution affects the body. So it can get into the lungs and affect the larger particles can get trapped in the lungs and cause direct inflammation in the lungs, and that inflammation can spill over into the rest of the body and cause effects there. And then the smaller particles can actually cross over into the bloodstream and directly impact organs in the body, and can directly impact the heart, the brain, and so on. So there's multiple ways in which air pollution can affect things, and its effects are both in the short term and in the long term. And in the long term, it can cause things like atherosclerosis, where you get buildup of cholesterol in your arteries. It can cause increased blood pressure, diabetes, and obesity, and so on. So what about Ireland? In Ireland, it's estimated that there's 1,300 deaths per year due to PM 2.5 in Ireland in 2018. Most of these can be ascribed to solid fuel use, with traffic pollution making up pretty much all the rest, as Jurgita detailed. As Jurgita mentioned as well, in Dublin, we've had the smoky coal ban since 1990. And the seminal study in 2002 by Prof. Clancy and others showed that there was a reduction in deaths from respiratory and cardiovascular causes due to this regulation. And as Jurgita mentioned, over 8,000 deaths now have been prevented in Dublin due to smoky coal ban in 1990. It's various different studies have been conducted in Ireland looking into the effects of air pollution. This one from St. James's looked at respiratory diseases and admissions with those, and showed an association between respiratory mortality and air pollution levels. This study from Dr. Quintine and others found an association between days with poor air quality and respiratory and cardiovascular admissions to hospital over the following 72 days or 72 hours. This study I conducted as part of my doctorate with colleagues from RCSI, including Prof. Williams, showed that there was an increase in short-term air pollution during winter. An increase in strokes due to air pollution in winter, particularly PM 2.5. So those high, pollution events that Jurgita mentioned in the last presentation, they are having clear effects on our health and increasing the risk of having strokes and cardiovascular disease and respiratory disease in the following 72 hours. So the corollary of that is that if we can decrease those the air pollution and stop those events happening, then we can save the health system and save everyone's health in terms of those cardiovascular, respiratory, and stroke instances and impacts. So what about inside the home as well? This study from Trinity showed that indoor air pollution is linked with decreased cognitive function in older people and dementia, and levels of air pollution in people's homes were found to be equivalent to standing on a heavy traffic roadside. And you can imagine you're at a heavy traffic roadside, you're not there for very long. You move on, you walk on. Whereas if you're in your own home, you're breathing that in, over hours, over days, and that's having a severe impact. And that's in particular these kind of magnetized particles produced from coal and wood. And those same particles have been found on autopsy in children, and have those same children's brains have shown early markers of Alzheimer's disease and of Parkinson's disease. So we can see clear, causative effect as well here of these particles, and that they're may have long-term consequences throughout your life, and exposure even at a young age can continue to have an impact throughout your whole life. So to conclude, many diseases have been linked to air pollution. It's estimated that particulate matter causes 1,300 deaths per year in Ireland, with the majority from solid fuel burning. There's evidence from Ireland that air pollution is damaging our health, and as I mentioned, cardiovascular disease, respiratory disease, stroke, diseases with major quality of life effects as well, such as heart disease, asthma, dementia, and stroke, have been associated with solid fuel burning. And it's important to remember it's not just about mortality; it's about the impact that these diseases have in terms of disability. The effects of air pollution have been found in children, and most importantly, we'll start to see the benefits as soon as we stop burning solid fuels, and we'll see them in both our own homes and in our communities as well. And to finish up, I think we need to consider this like the smoking ban in 2004. These regulations are going to reduce down our use of peat and smoky coal and so on, but that ban in 2004 of smoking kicked off a kind of a culture change in Ireland, where we don't smoke. People don't really smoke anymore around children anymore. They don't smoke in their own homes. They go outside to smoke, and that's had a culture change in Ireland as to how we see smoking, and we can see the dangers of it. And similarly, I think it's the same thing for burning solid fuels, that we can see that hopefully people will start to see the impact of that. Thank you very much.